everyone, Susan here. For all of you who are doing the Better Bones program, I thought this would be a good time just to chat a few minutes with someone else who's done the program. Actually, my friend Joanne Horrell.
Hi, everybody.
And Joanne actually came to me 11 years ago. 11 years ago, and she's been very faithful doing the Better Bones program. She's noticed terrific improvements in her digestion.
Yes, very much.
Yeah, and in her acid reflux has disappeared, in her energy level, in the liver functions, which were too high. And now the liver functions have corrected. But I want to chat with Joanne about how she used the Better Bones program and how she maintained herself to be motivated all these years. Number one, let me say that we met, you were into menopause 3 or 4 years.
Yes.
And you actually had, even though you began menopause with a very good bone density, you lost 14% in the hip and 13% in the spine. And that's about when Joanne said, even though I have good bone density, I better do something to make sure I keep this bone density.
Because I don't want it to be worse.
You don't want it to be worse. And so Joanne came in, we did the whole Better Bones program, we did the alkaline diet.
Yes.
And she was really careful to avoid foods that she knew she had developed allergies to. She alkalized very nicely. You did the nutrients.
Yes.
And consistently, now this is 11 years, consistently.
Once a month, I'm here for my vitamins.
Consistently, she does the nutrients. And her pH is in line. You've always done a lot of exercise, right? You're outdoors woman.
Yes.
You do.
Yes, I have large gardens. I walk every day with my dogs.
Right.
That's, so yes, I used to do aerobics and that. I don't do that anymore. I did, but I keep a pretty active life.
You do a lot. You're very physically active, and a lot of time outdoors.
Yes.
And it's interesting, even though she was outdoors before, she had a vitamin D deficiency when she came. So we always want to make sure that we have those medical tests, that our vitamin D is lined, that there's no other underlying cause. In Joanne's case, the vitamin D was one of the underlying causes. She took all the nutrients faithfully for all those years, did the alkaline diet, did the exercise, and as a result, her bone density has been very stable. A nice bone density. Maybe goes up a little tad bit, comes down a little tad bit, but as a whole, it's very stable. And this is remarkable because I have to remind you that the average woman, as she goes from 35 to 85, will lose 45% of her muscle and 45% of her bone. So anybody that says, hey, I'm stable, that's very, very good. And this is over 11 years. I know in my own case, it's a constant. I have to stay physically active, do a lot of physical exercise, and get adequate rest in order to keep my muscle mass up and to keep my bone mass up. So tell us, how did you manage to persist over so many years? How did you motivate yourself?
Routine. You develop a routine. I take my supplements pretty much within an hour every morning, every night. I try to eat healthy. I eat a lot. I stay away from processed foods as best I can.
Right, okay.
I eat a lot of fresh fruits and vegetables. I can all my fruits and vegetables.
That's
I have
pretty
big
nice.
Gardens.
Yeah, that's nice. Yeah.
That's a spoiler.
Yeah,
for sure. That's a spoiler.
Everyone can't do that, but you do it, and that's great.
Yes, I always have, and that was very nice. When I first came and all the foods that I was told to stay away from, and the idea of staying away from processed foods didn't scare me.
Didn't bother them.
No, that was a plus. And I think routine.
So just being consistent every day, taking it at the same time.
Yeah.
And there's got to be that you saw the benefit because...
my stomach. Yeah. I especially found that to be true, and I just trusted the bones were going to do their job.
Exactly, and that's a really important point because people often say to me, well, how do I know the condition of my bones? And I say, well, look at the rest of the body. The bones are like an indicator. If you say my muscles are pretty good, I'm feeling good, I have good energy, I'm sleeping pretty well, I'm not worrying so much. Our bones are just part of the entire body, and when the whole body's doing well, the bones are doing well. And so keep that in mind. Don't worry too much about the bone density test. Just we look for stability. We look to do as much exercise as we're comfortable with. We keep that pH in line. We definitely keep the nutrients. Some people will say to me, how long do I have to use these vitamins? I say,
I figured it was a lifetime.
you figured it was a lifetime. Why? Because the older we get, the more needs we have.
Yes.
The more needs we have to repair the body. If you think about it, if the body repaired itself perfectly, we would never age at all. But the body gets these little defects in repair, so to speak. And providing proper nutrients can really help the body repair better. Well, to me, it's really fun to have known you all these years. And
Yes.
it's really great to see how well you're doing, to see that bone density being nice and stable, and to see that you're looking fit, having fun.
Yes, yes,
And
I
you're-
am.
Yeah, and you're soon going to be 70, you said?
In the spring, I'll
There
be
you
70.
go. Well, congratulations. So we're gonna our whole life should be a time when we have healthy bones. Our bones were meant to last a lifetime, and I hope every one of you will think carefully about Joanne and this idea of commitment to taking care of yourself, staying on program, living a very happy, long life with healthy bones.
And thank you very much. Thank you for being here.
Thank you for being so willing to persist. Okay, we'll talk to you soon. Take care.